Good evening, students. Welcome back to our channel Ach'z. So today we had OET exam. So here comes the complete review of today's OET test, 20 July 2024. So let's discuss regarding the question paper. First set of reading. Part A was related to Williams disease. It's a repeated set of reading. Paragraph A including the definition, signs and symptoms of the disease. Paragraph B with the diagnostic evaluation. Paragraph C medication and side effects. And paragraph D with the management of Williams disease. Coming towards the C1 and C2, C1 including pulmonary embolism and C2 about snake bite. Now about the second set of reading. Part A related to agitation and aggressive children and the management in emergency setting. Paragraph A about several ways of agitation. Paragraph B about the medication or the drug. Paragraph C about the adverse effect of chemicals used. And paragraph D about the prevention and management. And in that, C1 about cervical cancer prevention and C2 about the mental health in adolescents. Now coming towards the third set, Part A about Parkinson's disease, again repeated passage. Paragraph A about the definition and meaning. Paragraph B about the diagnosis. Paragraph C includes the drugs and treatment, and the last paragraph about elderly care and prevention. C1 with TB drugs and C2 about choking and management. That's regarding the reading. Now about the writing module. First set, letter to community health nurse manager. Patient name is John Smith. Diagnosis, enlarged prostate and acute urinary retention and UTI. Patient temporarily admitted to hospital. The need is to insert a urinary catheter. So got inserted and done the trial votes and ended up in a failure. Later in the second attempt, the catheter inserted again for 10 days and later need urology consultation. So during that time period of 10 days, we need to request for community health nurse to visit the patient and assist him. Now about the second set of letter, again to the community health nurse. You are a registered nurse. Patient name is James. Patient is a postgraduate student. Medical history including gastroscopy done and antigen antibody test is positive. Every 6 months suggested with a blood test. So current problem is needle phobia. So we need to request the community health nurse to take the blood test. So we need to write a reference letter for home visit. So that's related to the second set of writing. Now about the speaking module. The first set of role play card including patient already scheduled for endoscopy. The patient is concerned about the procedure and also about the pre and post preparation. So we need to give assistance, detailed explanation to the patient and to reassure the patient for the procedure. So that's about the first role play card. Coming towards the second one, the setting was hospital ward. Patient is scheduled for surgery and he is complained on cannula site, severe pain and swelling on cannula site. So we need to reassure the patient about the condition. So coming towards the next role play card, school health nurse. You are a school health nurse and the patient with asthma, 10-year-old child. So child is very worried about the condition. So we need to reassure the patient. Now the role play card number 4, smoking cessation, that is the condition. So the patient is concerned about the aftercare. We need to reassure the patient and suggest the proper guidance. Now about the last module, listening. The first set including talk with a sleep practitioner and also talk with an endocrinologist. And the second set, talk with a gynecologist and also a talk with a neurologist. So that's related to today's OET test. So all the very best for your results and God bless you all. Stay tuned for more updates.